or just a roll call?
Sure, sure. I'll start with you.
Thank you. Melissa Van Hook, Chair of the Council.
Thank you. Vijette.
Good morning, Member of Council.
Thank you. Kelly.
I'm here. Thank you. Hi. Good morning. Sorry about that.
No worries. I know folks are muted. Kathy.
Good morning. This is Kathy.
Okay. And Monica.
Monica, council member, all that stuff.
All that good
I'm
stuff. Thank you.
multitasking, so.
Okay. And then staff. John.
I am here.
Michael.
Good morning, I'm here.
Okay. Lonnie.
Good morning, everyone.
Jason.
Good morning, I'm here.
And Sarah.
Present and accounted for.
Present and accounted for. And I'm here and awake.
Okay, that's a good way to be on a Friday morning if you have to, right?
Yeah.
Right. Let's move on to agenda item B, our minutes review and approval from our April 18th, 2025 meeting. I hope everybody had an opportunity to look at those minutes and review them. Before I call for a motion to approve them, are there any corrections or notes that need to be made to those meetings minutes as written? Okay, well, hearing none, I'm calling for a motion to approve the minutes as written for our executive committee meeting for April 18th, 2025. Do I have a motion?
So moved.
Thank you, Monica. Do I have a second?
I second. This is Kathy.
Thank you, Kathy. All those in favor of approval, please say aye.
Aye.
Hi.
All those opposed, please say nay. Is anyone abstaining? Okay, motion carries. Minutes approved. Okay, agenda item C, our fiscal contracts update with Ms. Lonnie.
Oh, wow. All kinds of stuff popping up. Hopefully you guys can see the ADDPC financial update.
Yes, ma'am.
Okay. And it's probably pretty small, but if I go too much bigger, it may be a problem. Are you guys okay?
Yep.
Okay. So the council received a total allotment of $1,501,328 for fiscal year 2023. The council has fully obligated these funds. A no-cost extension for the period of performance has been granted, and it runs through the end of September of this year. There's approximately $16,595 remaining to be liquidated, and that's for the legal options manual. We're just tying up some loose ends, so hopefully that will be processed soon. The council has received a total allotment of $1,500,684 for fiscal year 24 funds. The obligation and project periods are through September 30th of this year. There's approximately $377,636 remaining to be liquidated. These are the funds being used for the current 2025 work plan projects. The council has been offered the opportunity to request a no-cost extension for our 2024 award, which will provide an additional year through September 30th of 2026 for the project period to complete the contract activities. So we may or may not need it, but regardless, we'll probably apply anyways just to be safe. And good news, the council has received a third allotment for fiscal year 2025 in the amount of $820,412. This brings the cumulative total to $1,497,106. It's slightly off of level funding. There's approximately $582,106 remaining to be obligated. The goal is to obligate these funds by the end of September of this year or within the next few months, so that way the work can be completed the following year to meet the project period deadline. The obligation and project periods are through September 30th of next year, so 2026. And the final report will be January 28th of 2028. Unfortunately, we are not anticipating a no-cost extension for these funds, which is kind of unfortunate because these are the funds that were so delayed. But we'll see. Hopefully that won't be the case, but we really do need to obligate funds quickly so that way we're adhering to the period of performance. Any questions on this sheet? Okay, moving on to the next sheet, the council funded projects. This sheet shows all of the current projects funded by the council. Staff is reaching out to grantees to get final invoicing in. And one more thing of note on this one, the Sonoran Center, the Sonoran Center, you said their project for pregnancy support for people with disabilities, their second year contract has been given a 3-month no cost extension and now goes through September 30th of 2025. Any questions on this sheet? Okay, moving on to the final sheet. And again, this one's small. Let me make, oh, I didn't know, did it? Okay. Sorry. This sheet has been updated to reflect the projects outlined in the federal fiscal year 25 and 26 work plans, as well as the funding that has already been approved in the prior years. For fiscal year 2025, those funds will be used primarily for 2026 work plan projects. Currently, there's anticipated to be a surplus of $177,170. Staff is currently discussing potential projects for these funds now that we have a better idea of our funding level. And those are highlighted in green here. I know it's probably very hard for you to read. Sorry about that. We're trying to explore contracts that could be awarded by October 1st. So we can meet the period of performance requirement, again, which ends September of next year. And the administrative budget has also been increased to reflect the work that's being done with the comprehensive review and analysis. Any questions on this sheet? Did I hear a beep?
Yeah, it's me, Kathy. So up above you had 582,000 that we need to obligate quickly, right?
Yes.
And is that separate from that last sheet you showed us? So are those?
Yeah, so some of that 580 has already been identified as projects. So some of these will be renewal projects that will be voted on today.
Okay.
So you'll see here that some of those projects already have funding tied to it.
Okay.
177 doesn't have any funding tied to it. And so that's kind of where we're trying to identify projects to fill the gap in funding there.
Okay. All
Does
right.
that make sense?
Yeah, that's better number. 582 is a lot of money. Okay.
Yes. So yeah, we'd have a hard time within the next 3 months figuring out how to spend $582,000.
Yeah.
So
Okay. All right. Thank you.
no problem. Any other questions? Okay. Thank you guys.
Okay, Lonnie, thank you so very much. We're going to move on to John's Executive Director report, and we have much to discuss. So you're up, John.
Yeah. All right. Thank you. There are a few things going on in the world right now, as you might be aware. There are more than a few things going on in our part of the world. So I'll try to give you an update. Please feel free to ask questions if anything I say doesn't make sense. It often doesn't. So first, I want to let you know, we keep coming back to this issue of council member appointments. I want to let you know that 2 of the members who have been in the process for 21 months, I believe, are now formally approved. Jeffrey Studer from the Department of Education and JC Farkas from the Sonoran Center for Excellence in Disabilities have been formally appointed to the council. So we now have an ADE representative, which we haven't had since the summer of 2023. And we have our second USAID representative, which we haven't had since Wendy Parent-Johnson left quite a long time ago. So pleased to have those appointments. We do have several other people in the mix. I do want to let you know, in case I didn't mention it at the last meeting, or if she didn't mention it, Jessie Barbosa, who had been with the Department of Health Services and was the ADHS representative, had left ADHS because her position was eliminated as a result of a federal funding cut. She now works for Disability Rights Arizona, so we have the privilege of continuing to do some work with her, but we are also now in the process of having to get a new ADHS representative on the council. That person has been identified and has applied, and so I've communicated with boards and commissions. They know of his status as one of our mandatory members, and they'll do what they do, but we're not holding our breath that it's going to be that we're going to see an appointment anytime soon. But at least we have that, and then we have two other community members we talked about before, Leanne Fuller and Justin Harris, who are also in the process, but they are probably going to be in that process for a while still. So just a heads up on that. Regarding our federal grant award, Lonnie mentioned that we got our notice of award. It was a little bit lower than level funding, but not tremendous. I mean, it was a matter of a few $1,000s. It wasn't a massive hit. And I would point out that last year we got a late in the year notice of award that brought us from what would have been slightly less than level funding up to essentially level funding. It's possible we will see one of those late in the fiscal year notices of award again this year. No guarantee, but it might happen. In any case, we are really, really close to being level funded. And so we're certainly not complaining about the position we're in. Some other councils saw much larger decreases in their funding. Some councils saw increases because the funding tool rebalanced to support some changes in state populations and so forth. So in any case, we're in good shape, and we feel good about moving forward, because next item, the fiscal year 2026 federal budget proposal that was just shared includes council funding and includes P&A funding, and in a weird sort of way doesn't but does include USAID funding. And I can't even begin to explain how that all works, but the good news for us is that councils are funded in the budget proposal. Now, this is a complete 180 from what we talked about at the last council meeting and the last executive committee meeting, which was that the councils and the P&As and the USAIDs were being zeroed out in the administration's initial budget pass. So obviously we were, if not panicked, at least a little concerned at that time. We feel much more comfortable now. And I was in Washington, D.C. last week, and I had a meeting at HHS with our program officers at the Administration for Community Living, and they seem very confident that that this funding is going to go through. They seem very confident that the councils continue to be a priority within the Department of Health and Human Services, and that we will have a bright future, essentially, is what they're saying. Now, obviously, a million things can change. I don't want to say that we know this for a fact, but for the time being, I think we are comfortable in the knowledge that we are included in the 2026 budget, and we look forward to seeing that funding come through. Now, one other thing to note, as has been the case in recent years, there is the possibility that we will not see a federal budget by October 1st. We may have to operate under a continuing resolution again. It's important to note that the administration is months behind in the work it should be doing on the budget. And so every federal department is essentially playing catch up. And even though we've seen a budget proposal from HHS, whether a full federal budget is in place by the end of the fiscal year is a very open question right now. And so we just have to be prepared for that as well. If we have to operate under a continuing resolution, so long as our funding is included in that CR, I think we're fine, although it is far from an ideal situation. Just something to kind of keep in mind. I just mentioned our status within HHS. I also want to note some changes that are happening within the department, and we touched on this at the last meeting, that the new secretary is proposing to do away with the administration for community living. There is an injunction in place to prevent that from happening temporarily. But the plan still is to do away with the administration for community living and put all the AC or most of the ACL programs under what is now the Administration for Children and Families and is going to become the Administration for Children, Families, and Community. Lots of stuff going on. So if that happens, if that injunction is lifted, if ACL is eliminated, the councils and the PNAs will move under the Administration for Children, Families, and Community. That is the design within the department right now, and we're waiting to see what happens with that, with the lawsuit that is trying to prevent that. But I would say that the odds are that we will be moving. We will have a new umbrella over us, but our program officers are going to stay the same. And the folks we've worked with historically, other than those who were let go, essentially, I think will all stay the same. So we don't anticipate much of a change in that respect. We do anticipate that things will be fairly smooth. They're being given all kinds of time to make this transition, so we hope it'll work out very, very smoothly. That is the best we know at this point. Again, lots of things still have to happen before that is formally in place, and we'll of course keep you apprised as things move forward. Touching on the 2025 and 2026 work plans, again, as Lonnie mentioned, because of the late notice of award, we have not been able to obligate the money that we hoped would come to us, and now that we know will come to us. So we're trying to play a little bit of catch up with our 2025 work plan. In most respects, the plan is moving forward. The goals and the objectives are being accomplished. The activities are being undertaken. We've made some slight adjustments based on some changes in the environment, but for the most part, things are in very good shape with the 2025 work plan. Now looking to 2026, we want to obligate this 25 money so that it can be used in the next year. We do have to submit our proposed 2026 annual work plan by August 15th. And so we are meeting, we are talking, we are discussing all kinds of things that can happen in the next year. And as a staff, we are meeting again on June 30th to kind of line out where we are this year and what we propose either to move forward or to introduce in the next year. I believe I've also mentioned this, but one of the key elements for us moving into 2026, if we introduce anything new, we want to make sure that it's something that can transition into the new 5-year plan that begins in fiscal year 2027, unless it's a 1-year project. If it's going to be a longer term project, we want to make sure that it's going to fit in to the goal areas that get established in the next 5-year plan, because the goal areas and those objectives may change. But we want to make sure that things can transition without a whole lot of disruption. So I hope this makes sense, but if not, I'm certainly happy to try and explain it better. Marcy might be able to do a better job than I can. But we feel like we've got good ideas right now. We're short on a few. We may have to invent a few things that we don't have on the books right now, but we will ultimately, I think, be able to accomplish the goals of this current 5-year plan and move smoothly into the next. Regarding grants and contracts, Lonnie mentioned that there are some areas where we have not obligated money, where we are planning to move some contracts into an additional year. Those are some things that will be discussed in a few minutes. We, for the most part, I think, have been satisfied with the work that's been done on our current grants and contracts, whether supported decision-making, self-advocacy, some education-related projects, a variety of things. So those that were not already defined as 1-year contracts or contracts that were designed to end this year, we intend to move forward with those, and we'll present those to you now. Now, there is one project that we wanted to bring up with you that we have some very serious concerns about, and we thought it was only appropriate to share it with the executive committee before potentially bringing it up with the council next week. As you know, the council's been doing a lot of work in recent years on sexual violence and sexual abuse, targeting people with intellectual and developmental disabilities. It started with Erica, even before the Hacienda incident. It has clearly continued over the years, and the council has invested a lot of money in this area. We are currently funding a contract with the Sonoran Center to take advantage of a report that was issued by Dr. Lynn Tomasa under a grant from the council. And that report was issued last year. We wanted to build upon those findings and build upon the prior work that's been done through other grants related to this area, and ultimately come up with some policy proposals that could help improve conditions for people with IDD, whether to increase the prevention efforts or to improve the response efforts when sexual violence or sexual abuse does occur. We have not been satisfied with the progress of this project. We have not been satisfied with its ability to stay on course or to stay on schedule. We also have not been satisfied that certain milestones or certain goals, certain activities within the contract have been achieved on time. So we have sent a letter of concern to the Sonoran Center and to Dr. Tomasa, who is the researcher, the PI on this project, asking for them to address our concerns and to give us a very concrete timeline and a very concrete project plan for the remainder of this fiscal year. The contract goes through September of this year. We need to know if and how the goals of the project can be accomplished in the remaining 3 months of the contract. The problem is that, from my perspective anyway, and I certainly invite Marcy or Lonnie to chime in on this, from my perspective, it would seem very, very difficult, if not impossible, to achieve the goals that were set forth in the remaining time, given how far behind the project is. And there are many reasons why this is the case. I can't even begin to go into all of the various reasons, some of which we find justifiable, some of which I think we don't. So anyway, the long and short of this is that we wanted to make you aware that there is a possibility that we are not going to be extending this contract. There is a possibility that we are going to be either issuing a new solicitation or finding another way to issue a contract related to this work, because it is very important to the council. It is very important to the IDD community, to the disability community in general. We don't want to see the work that we've done up to this point just drop, but we also need to be investing council money in a project that is going to achieve the goals that were set forth and that is going to adhere to the contract that is issued. So with that, I'm going to stop for a minute and ask Marcy or Lonnie to add anything more that I may have missed, or to correct me if I'm off base.
This is Marcy. No, I think John covered it clearly. We monitor the reports. I shared the reports with John. We had a call with Dr. Tomasa last month to kind of go over, basically some of the big concerns that we had with the contract, and listen to her as far as from her perspective what she was encountering. And then we basically asked for a revised budget to help support Dr. Tomasa's work in it. So part of it is personnel, and then part of it is just how she handles things very differently. And so the scope of work had 4 criteria for them to achieve, and then they added a 5th one, which they're on par for 2 out of the 5. But out of the 4 key areas, the main concern was working collaboratively with a committee to help oversee the work and move forward on the other 3 areas. And if you don't have the core group that is meeting, that is identified, that is consistently working with her and her staff, then things kind of fell apart. So, we'll see what she comes back with. They have 2 weeks to submit a corrective action plan with a timeline and an updated budget. And then we'll review that internally and probably follow up in another phone call with Dr. Tomasa and JC. Hopefully we'll be on the call and make a determination, because one thing that I expressed to John previously this week is the council should make the final decision on how they want to proceed with any renewal contract. But we have to provide you guys with all the information and the details in order to make that decision. So we So we're gathering that right now. And then once we know how you guys want to proceed, then we'll know how internally we are going to move forward with this objective, which is very important, that all the work does not go to the wayside. Melissa?
John and I did discuss this recently, and I had inquired about how the USUD was doing with their other projects as well. You know, I'm concerned with them as a whole because, and please let me know if I'm just out of the loop on this, but other than the Native American Center, they're kind of struggling with all of their projects in some regards. Is that correct?
No, not really. So
Okay.
the crisis, Lonnie, you're gonna have to pull, so they have the Native American, which is running on the 4th year. That will go through the 5th year, and that contract ends in September, and that's been operating very, very well.
Yep.
No concerns with that. The crisis intervention, trauma-informed care, I provided John a summary of that, and they're on target and are meeting all their objectives per their proposal back to us. The pregnancy and parenting program is a collaborative effort with, I believe, Mercy Care, Ability 360, and sorry, Jan, I'm still referring it to RSK. So I know you changed your name, but that one has been a little bit soft, and I'm going to use the word soft. I'm not saying they're not on target, that they're not doing what they achieved. It is a very different collaborative approach project, which has a no-cost extension for them to continue on with some activities. They're really centered around meeting with individual families and self-advocates related to pregnancy and prevention, and ensuring that moms have a chance to share their experiences with other new moms and self-advocates, and sharing resources and information. So it was a little different than the approach that ASU took, which was very research-based and has a resource document to share, and that has been nationally shared by Dr. Lightfoot. The NAU project is focused on the 0 to 5 age group, and that program is working very well, but that was a very different approach. So all three have to be looked at differently. I wouldn't say they are off target. They're just doing the project very differently, and it could have been doing more, in my opinion. And I have asked to see more on what the collaborators have conducted to date and how they're working on this project. So I hope in the next report we receive that additional information from JC.
Okay, that's helpful. Thank you. That makes me feel a little bit better. So really, whatever we end up doing with Lynn Tomas's project and funding on that is absolutely going to depend on what comes back, what information you get back from her. So,
yes.
Yeah.
Yes.
I know that they were supposed to have set up that advisory committee months and months ago, January. If not, I think they're not even close to getting that completed. So, okay. Thank you.
And I think John and I understand, and anyone obviously understands who's on boards and commissions. It is one thing to, let me say this, in their original proposal, why it was so strong by the outside evaluators was because they did identify a number of people to participate on an outside group, and they were methodically going to ensure that those folks who were identified could participate, had the time to participate, and could contribute in a meaningful way. And I think that gave a lot of comfort to the outside group, and certainly to the internal staff that reviewed the proposal, to say, they've already identified folks, and they look like they can hit the, they can move forward within the first 3 months of getting this group coalesced. That's not what happened whatsoever. And, I'm still unclear. I don't have a full understanding why that fell apart so quickly. And what Lynn has been doing is having some individual conversations here with folks and another conversation with another person here to get feedback on. And it's siloed. And though she could be sharing information and cross-sharing information, that doesn't speak to the bigger cohesion of pulling folks together to oversee, a project where this scope of work was based on her report that took longer than expected to get the report completed by her, well over 2 years post what it was due. But this scope of work was based on her recommendations around systems change. And you cannot do a systems change project individually making decisions without having the key players involved on how this is going to impact the system and their input on it. So having individual conversations with DDD or somebody else doesn't really help if you don't have everybody's input on, the bigger picture of things. So, back to John's concerns, that he pointed out, and what we addressed in this letter to her was, we want a corrective action plan for each of these 4 tasks that were part of the scope of work to address specifically. What is the corrective action plan? What will be in place? If you cannot achieve this corrective action plan, what are you suggesting? Which kind of brings them out of compliance again. And then what is the budget to support that? So we are asking for a lot of information, hopefully to receive in the next 2 weeks to review and to share, and to see how we can move forward with this.
Okay. Are you hoping that we will have that by full council?
No, the full council is meeting next week. I gave her till the 7th of July to submit something.
Okay. I don't know why I was thinking it was 2 weeks from today. Okay. All right. Well,
on her part. So yeah, we do have to allow some time for them to respond, and give them the time to put something together. And hopefully, obviously with the end of the year coming in, 4th of July, I figured just make it the 7th of July, that following Monday, to receive something. And we're going to have to pull, obviously, some discussions together with you, Melissa, and figure out how to proceed whichever way it goes.
Okay. I know Lynn has done some great work in the past, but I know that the timeliness has always been an issue. So,
and you know what? I'm so glad you stated that, because here's the thing. We all know Lynn. We have worked with Lynn on many different capacities. This is not to say anything in whatsoever negative about Dr. Tomasa and her skill level and experience and expertise that she brings. There is nothing about that. It is just about the management of the project and keeping to a timeline and making sure that the ball moves forward. And some personnel left U of A that were going to work on this project, and that's been one concern. U of A is having difficulty hiring people. That's outside probably our realm, as well as sometimes JC doesn't have a lot of say in that with the universities and their hiring and delay process. So some of those things are out of our realm, but we do have to think about with Lynn and JC is to think about where now, if you identified a corrective action plan, where is the support going to come from to move it forward, and to bring it back on track? Or if not, see what happens in the next 90 days. It's going to be, to John's point, could be difficult because so much time has passed. So I'm not taking anything away from Lynn. I'm sure John and Lonnie and anybody else would agree with me. Lynn is a fantastic person, has worked in this area in so many areas, all of her career life, and she has a deep understanding and breadth of knowledge. And this is not in any way, shape, or form to disrespect that.
I agree with you too. That's why I know the work that she's done in the past has been excellent. She's contributed a lot to the field. So I'm hoping they can kind of come up with a plan that's achievable. What is kind of the final date that council needs before we make a decision to approve or not approve the second year of funding, or an additional year of funding?
Yeah, I don't, Melissa, be quite honest with you. The council meets in September. Obviously it will have to be decided at the council meeting in September how to move forward with Dr. Tomas's project.
Okay.
And let me just throw out a scenario, for example, they come back with a corrective action plan and, we say, okay, looks good. We're going to give them the go ahead to move forward on this corrective action plan, approve whatever sort of amendment on their budget to achieve it. Bring this back to the council in September with all this information that they provided. And if you guys are good with the it's late in the game with the corrective action plan, but if they are achieving those benchmarks and we can document that they're achieving the benchmarks, they will still have to submit some sort of renewal application to the council. And we would have to ask for that for the September meeting. You guys don't meet any other time unless we bring everything up to executive between now and September. So the problem that we always run into is this period of obligation dollars that Lonnie is consistently worried about and beating us down with it lovingly. But we have to do certain things quickly on our end, and sometimes John will try to figure out how to get this information in front of your eyes in order to give us the go ahead to move forward on something. We're not going to move forward on anything with Lynn's project without council or at least executive committee consideration.
Okay, thank you. And it sounds like there's multi-steps in there. Sounds like first you need that corrective action plan and look at it, and then a little bit of progress and.
Yes.
Got it. Okay, and them having to submit another renewal application and to have that.
Yeah.
It's a few steps. So, all right. Thank you for the background on that and all the information. Does anybody else have any questions about this project for our staff? Go right ahead, Ms. Kathy. I'm going to mute out.
So does this impact the funding, and will we have excess funds available if they do not meet whatever they're going to propose in the corrective action plan? I'm just curious. Will there be funds that won't be given to them, and then we'll have to think about how we can use those, or we return them back to ACL?
The short answer is yes. I'm sorry, Lonnie, go right ahead.
Oh, no, that's very true, Kathy. And that is something that we are considering and working through potential solutions for, depending on whether or not they do correct and can get continued funding, or should it need to not be funded again? What does that look like? And having scenarios for, I think, both situations.
Okay, thank you.
Okay. Thank you all very much for your input on that and the discussion around it. I want to also echo what has been said. This is not you said bashing. This is not Lynn Tomasa bashing. This is simply us trying to share with you. This is a significant investment of council dollars. It's somewhere in the neighborhood of $72,000. So we want to make sure that it is appropriately invested and that the work product actually meets goals and makes a difference. So that's why we're bringing it forward to you. The last thing I want to share with regard to grants and contracts is our legal options manual update, which is also being undertaken by the Sonoran Center. Disability Rights Arizona has been heavily involved in that. We do now have the English version of that document, and we are sharing that with the community. We will be posting it on our website. We will be making it available in print format. What we don't have yet is the Spanish translation. So we are still awaiting that. That too has been delayed a bit, largely because of some personnel changes at the Sonoran Center and some other factors that have played into this. But we expect it in the very near future So as soon as we have that, we will also be making that available online and in print. Sarah, did you want to say something about the status of that?
Yes, I just got confirmation from our print shop that they have done the very first run. It's a small run of 25 copies. We're making sure that it's gonna, look okay. But I'm gonna go pick those up after this meeting. So if someone wants one, let me know. I will come drop some off, Jana, if you want me to.
And we will be at the IHD conference next Monday and Tuesday, so we will have copies available for folks who want to pick those up from our table. And we'll also make sure that people can get it electronically if we run out of those print copies. Okay, VJet, we will make the drive out to Lake Havasu to do that, to drop one off for you.
Perfect. Thank you.
All right. So that's good news, because as we've talked about before, that hasn't been updated since I believe 2016, and much has changed in the last 9 years. It is a very, very important document, and one that is requested of us a lot. So it's good to have the most up-to-date version of it available. And by the way, it includes current information on supported decision making, which we are trying to promote, obviously, in many different ways. Okay, so regarding the state plan development, many of you have been involved in our outreach efforts around developing our 2027 to 2031 state plan. Many, many thanks to all of you who have contributed. Vijette was host to a fantastic community conversation earlier this week out in Lake Havasu. 28 people, I think, showed up for it. We had, not only did we have 2 full hours of conversation, but many of the attendees stayed around for about an hour afterward to have further discussions with staff and with each other about some of the issues that were raised. So great session. We've also been to Somerton, we've been to Payson, we've been to Tucson. We are going to Surprise next week. We're going to Tuba City on July 7th. We're doing a couple of online or virtual versions of the community conversations. So we're doing our outreach. IHD has done a fantastic job of accumulating information for our landscape analysis. Things are really coming together. Many, many thanks to Kelly and her team, Megan Donahue in particular, who's kind of leading the charge on this. Things are progressing, and we're very much looking forward to the results of this outreach effort and to the comprehensive review and analysis that is going to result from it and be available this fall. It is a big task, as all of you know. If you were around, 5 years ago when the council had to do its last one, you know that there's a lot of effort involved, a lot of personnel time involved, and it just it's demanding. But everybody on staff has done, I think, a fantastic job, and we're really pleased with what IHD is doing to support it. So many thanks, and to those who are on the council who have participated or helped organize, thank you all very much as well.
And John, I'd like to thank your ADDPC staff. It's a really great collaboration. So thank you, all of you, for support.
Well, thank you. Our transition, I mentioned, I think, at the last council meeting, we have recently transitioned from being under the Division of Business Services within DES to now being under the Office of Community Engagement. So rather than being in a division that really didn't have a whole lot to do with human services, we are now in one that has a lot to do with human services. The transition took place late April. There have been, a few little bumps in the road, not significant stuff, but the leadership we had under DBS had a very good understanding of how councils operate, how we operate, more or less autonomous from the state structure. The leadership at OCE was not provided that education during the transition, so we've had to kind of bring them up to speed on how we are not necessarily subject to supervision by the state. We are subject to supervision by the council, a few things like that. So there's a process of education that is taking place, but in general, this transition is going smoothly. We have tremendous support from the leadership at OCE. We are among kindred spirits, I guess I would say, in terms of the priorities of OCE in generating awareness of the needs of vulnerable communities and the needs of communities that are at risk. In just about every respect, we have great support, and we look forward to a strong partnership moving forward. It's kind of nice in some respects to now be part of a group that knows what we do and we know what they do, and we can all work together. Some great partnerships, I think, will result from that. The last thing I would mention is the Arizona legislative session, the session that will never end. And I'm pretty sure we all may be in the grave before this session ends. There is apparently movement on the budget. The budget is the one thing that stands in the way of the legislature going home. And as usual, we in Phoenix would like nothing more than to see the legislature go home. Once they get the budget passed, they will be able to do that. The one thing I would mention is that there are still a number of bills. Some really positive bills have been passed this session related to education, related to school emergency planning, related to, for example, DDD funding. We're all very pleased with that. Unfortunately, there are still some, what I think we would consider to be some dangerous proposals still in the hopper. There are several that are trying to further restrict the amount of money available to access in general, but ultimately, if they're going to restrict funds available to access, it's going to have an impact on the disability community. So we are keeping an eye on these things. We obviously can't lobby. We can't express a point of view about the bills, but we can educate people about the impacts of various pieces of legislation or various proposals should they go into effect. So we are doing that. Many thanks to Jason for his ongoing eagle eye with regard to the legislature. As we mentioned in a previous meeting, once the legislature goes home, we will be hosting another kind of wrap-up webinar to inform the community about what some of the outcomes are, what some of the potential impacts will be, and maybe even to touch on some of the things that are happening at the federal level, which continue to be worrisome. And it's kind of anybody's guess on where things are going to go. Many of us here, Jana, your organization, Kelly, your organization, many different organizations are going to be affected by what happens in Congress. So we, as I said, keep our eyes on these things, and we will be educating the community about what is going to happen and what they can likely see in the future as a result of the actions taken. Yeah, that's about all I can say on that right now. We certainly hope the budget will be wrapped up soon, and that it won't do any extraordinary damage to disability services moving into the next year. So thanks for your patience and your time and your discussion on these things. I'm happy to answer any questions you all have.
Okay, thank you to you and Lonnie and Marcy for all of that. Let's move on to agenda item E, our contract grants and renewals. Okay, there we go. Thank you. Otherwise, I got to whip out my glasses for my little one here. Okay, so probably.
Go ahead.
I was just going to say, it looks like we need to vote on each of these, and I would just recommend that we vote on them individually after the information is shared. That's all, unless you have a different suggestion.
No. Thank you, Melissa, and thank you, Executive Committee, for reviewing the proposals. Typically, this would go through grants, but the Grants Committee currently has 4 members, and 3 of the 4 members are part of Executive as well. So the 3 that were willing to attend are on this meeting, and rather than make them sit through the same thing twice, and to have more eyes and vote on the proposals, we as staff decided it would be best to review them with Executive instead. I'll be going first, talking about the online privacy and safety, otherwise known as the OPS project. The proposal is for year 2, and it was submitted by NAU IHD. This project is aimed at equipping individuals with intellectual and developmental disabilities with the skills to navigate the digital world safely. The project has made significant progress in its first year and outlines plans for continued development and sustainability. The OPS project addresses the increased risks of cyberbullying and online fraud for individuals with IDD, emphasizing the need for accessible digital safety training. Since its launch, the project has successfully delivered culturally informed training sessions across Arizona and adapted this training based on participation feedback. So that's one thing that I really love about this project, is that they're adjusting it based on people who have gone through it to make sure that it works for, future participants. Internet access has increased exposure to online risk for individuals with IDD, and the OPS project has delivered engaging training sessions focusing on cyberbullying, safe browsing, and social media privacy. Initial training sessions involved 13 individuals with IDD and support staff, leading to refinements and again, the training was adjusted based on refinements from participant feedback. Partnerships with 11 organizations expanded outreach. Despite some low attendance early on in the sessions, these organizations have been able to expand that outreach. New models on online dating, safety, and financial privacy were introduced in response to the participant feedback. Some of the key activities and achievements in year one: the team has conducted multiple training sessions and developed a structured curriculum to enhance digital safety. The project is on track to exceed its original goals for training sessions and participant engagement. 6 training sessions have been completed with various community partners, reaching over 60 individuals with IDD. A Canvas course shell has been created to centralize training resources. The project aims to conduct at least 17 training sessions by the end of the contract period. And final tasks include completing a summative evaluation and drafting a cumulative report. And so that's kind of an overview of what happened in year one. Now, the future activities and sustainability plans for year two are as follows. The OPS team will implement new activities, including asynchronous training modules to enhance the accessibility and reach. The project aims for long-term sustainability beyond the ADDPC funding through partnerships and robust online presence. Synchronous training sessions will continue both in person and virtually, with at least 2 offered both in English and Spanish, as well as American Sign Language if requested. Development of asynchronous open access versions of OPS training is planned to accommodate diverse learning styles. A training will be freely accessible to individuals, families, and organizations, ensuring ongoing support for the IDD community. The project will establish partnerships with community organizations to maintain relevance and usability of the training resources. And the goal is to establish flexible, lasting resources that will allow users to engage with the material at their own pace. So, it's not a one and done. They could go back and see whatever part of the curriculum they may need repeated or around by the sound of it. So that's good. The team and expertise in their roles. The OPS team comprises experienced professionals dedicated to delivering high quality training and resources for individuals with IDD. Each member plays a crucial role in the project implementation, evaluation, and outreach. Our very own Kelly Roberts oversees the project and activities to ensure quality. I'm not going to say the name, but yeah. Other staff will manage the evaluation and curriculum development, leveraging their expertise on online privacy and strategies. John McDermott leads the outreach, training, coordination, focusing on accessibility and user friendliness and materials. And Amber King will also provide logistical support, assisting with project operations and ensuring compliance with requirements. NAU IHD is seeking level funding, so that'll be $72,124 for year 2 of the online privacy, safety, and training project. And Kelly, if you want to add anything, sorry, I kind of butchered it, but it was a very long proposal. And you're doing very good work. So we were all impressed with your proposal.
Yeah, our team's doing a good job, in my opinion, as well. Thank you. And I don't have anything to add. Thanks, Lenny.
Keep your feet set. Bring it down as you were sitting into a chair.
That's it for me.
Okay, that's exciting. We get so happy when we hear that people are on track and even exceeding. Good work, Kelly, to you and your team out there. And Jana has noted that this is amazing training. Go right ahead, Kathy.
I do. I'm sorry. Go ahead, Kathy.
No, go ahead, Kelly, and then I'll ask my question.
I want to make sure that the end product is accessible to folks and used. And I find that I don't remember things. So being able to do a Google search and find information. So we've talked about also having some of the key components be available in that format. So that would be in addition to what was proposed. I'm just wondering what you all think about that. Like being able to search and find the information that we're creating and presenting in an easy format that's kind of like a one-off, like search for, I got an email that looks like phishing. What do I do?
I think it's fantastic. I was in DC with John at the APSI conference, and so much of that track and what I was on AI and technology kind of in general. And it is just amazing how much over the course of the last year or two, all of it's being used. So I think that it's very smart to figure out a way to make sure that people can find it. So I'm in agreement with that. Kathy, I know you had a comment or question.
So Kelly, so you've trained 60 individuals, correct?
That sounds about right. Yeah.
So are you collecting data on, are the majority of them using phones or is it computers? I'm just curious on that data. What are we seeing our participants using?
It seems like phones and tablets primarily.
Okay. And is it all of our individuals with IDD, are they the ones really using the phone and the tablet, or is it the parents? I'm just curious.
I can't get too specific because I haven't attended every session, but my understanding is that we've had a lot of parents attend, but also the individuals with IDD who have attended are using the devices. I would say, if I had to guess, about 80% of the time with the individual with the intellectual, with IDD using the devices. But I can check on that and get back to you because those are really good questions.
Well, so the other thing I had a question about is how the training is really just to make them aware of how to do it. Have you asked them to show you if they've are proficient in what you're training them? I'm not sure what your training looks like, but just curious is after they leave the session, are they proficient in something to be aware that they understand what you've trained them on and how to use the device? That's what I think
There are some checks and balances, and it varies by person.
Okay.
So is every person walking away knowing what to do in X situation? No.
Okay.
But the intent is to also just increase awareness on, a lot of what you're seeing isn't real. How do you check and then help protect people? But that's another really good point. And maybe we can include something around that and follow up, weeks later with a refresher, using some of the same information, even a link that could take them to a site to check for understanding and provide some training or something. You know, like if they get the answer wrong, what do you do in this situation? If they get it wrong, then it sends them to an updated training. I'm putting a lot more on our team, so forgive me if it doesn't come to fruition, but I like the idea.
Well, sorry, I didn't ask the staff if that's okay. It's just, it occurred to me as like, do we know that they're walking away knowing, really understanding it, knowing how to use it?
Right. No, it's a really good point.
That's it. Thank you.
Are there any other questions or comments? Okay. Hearing none, I am going to call for a motion to approve the Online Privacy and Safety OPS Year 2 for NAU Institute for Human Development. And I don't have that amount. I know it was 92 something. What is the amount of that? There it is. 96,420. Okay, in the
Oh,
amount.
actually,
Oh.
Melissa, that's in total, including the match.
Oh, there's ours. Not 72. That's what we are.
Yeah, 72,124.
Okay. Do I need to restate that whole motion? I can. Okay, so I'm calling for a motion to approve Year 2 funding for the Online Privacy and Safety OPS from NAU Institute for Human Development in the amount of $72,174. Do I have a motion to approve?
It's 124, Melissa.
Oh, 124. I have new glasses on order. I'm waiting. Okay, 72,124. Pardon me. Do I have a motion to approve?
I move.
Thank you, Kathy. Do I have a second?
Vijette, I second.
Thank you, Vijette. All those in favor of approval, please say aye.
Aye.
Aye. All those opposed, please say nay. And do we have one abstaining?
Yes, this is Kellyanne. Am abstaining. Thank you.
Okay, thank you. Okay, motion carries. Congratulations. Now it goes on to full council. All right. Thank you.
Okay, I'm going to cover the next two. Thank you, Lonnie, for covering ops, and to Kelly for a great program. I attended 2 of the trainings in the very beginning and towards the end, and it was really good. And a lot of what I appreciated the most out of this is that throughout their trainings, John and his staff were very gracious in taking a lot of feedback from all the participants and continually to update it and to expand the topics. So we're excited to see the next year. Okay, so the next one up is support decision making with the ARC of the U.S., which is passing through the dollars to the ARC of Arizona for a 3rd year at $70,000. The top of the proposals you'll see is the clarification reply that we asked them to clarify a number of budget and programmatic things. And then behind that is the budget, revised budget, and then their full proposal. So what I'm going to cover is just a summary of this particular proposal and some of the key areas that they had to clarify because we needed additional information on how they were going to move forward. Part of what they wanted to do was to make this self-sustaining project, knowing that we're at a 3rd year funding, and in addition to just the ongoing trainings that they've done around the state, they do a number of in-person trainings, and then they do a lot of virtual ones. They are proposing, and they started to work on this in the last quarter, is to do a train to trainers. And so a lot of our questions were around how they were going to develop this and implement and sustain the train to trainers model. So what I will summarize for you is basically just an overview of what they've done to date. Going back to page 2 on their clarification, we wanted to know what numbers they have reached as far as their target. They have done, as of March 30th, 32 self-advocates have attended a support decision-making training, 90 family members or caregivers, 138 professionals for a total of 2,029. They are asked to do a survey with some of the demographics. We understand that not everyone likes to include their personal information. So you'll see 1,797 folks do not self-identify, which is, it is what it is with a lot of folks who don't want to identify, but we appreciate folks that do, and we include that obviously in our final reports. They have also reached the counties, obviously a lot in Maricopa, Coconino, Mojave, Pima, Pinal, Santa Cruz, and Yavapai. In the third year, they're going to do outreach to additional counties, such as Yuma, Flagstaff, Shoalo, and Lake Havasu. They plan to target in the third year. They have a board member that oversees, that reviews the curriculum with them. We wanted to ensure that their board meets on a regular basis. They do provide their backup minutes in their reports. And what they are doing with their board members this year is also to be kind of the overview and guinea pig of the trainers. So they're gonna make sure that those board members, if they have the opportunity and able to, become the first folks of participating in Train the Trainer, where they go through the training, they review the curriculum, and then see how it goes with them performing the support decision-making training in their own communities. I don't have the list of where these folks are, what counties or what communities are in, but there's 19 board members listed in the proposal, and we appreciate them utilizing them and their experience and expertise. So the Train the Trainer model, aside from what they're going to do in their third year, which is conduct in-person training, go out to a couple of communities that they still want to do outreach to, additionally to Native American communities as well. You'll see in their timeline, they identified per quarter how they're going to roll this out. They want to target a number of 40 trainers, and they have outlined benchmark numbers every quarter. So they want to have at least 15 trainers recruited by January 2026. So remember, if this gets approved, this is a contract that begins in July. So for the first 6 months, they are building this out. They are identifying trainers. They are putting them through the curriculum training. And then the next half of it is the implementation by the trainers and the monitoring by the ARC of the US and DRAS. So they want to recruit at least 15 trainers by January 2026, 30 by April, and then 40 by the end of June. And by that, this program will be self-sustained, with the ARC still overseeing much of this work with the training materials, their PowerPoint presentations, and then providing any technical assistance to the trainers. Part of this is, where do they plan to identify these trainers? They state that their goal is for school districts and service providers and state agencies to adopt the full curriculum and provide it for individuals. They plan to promote it on their website, via social media, and at in-person events throughout the year. They plan to schedule training sessions with each of the participants for 4 to 5 hours. They have to demonstrate their ability to provide and teach back to their master trainers, which is Melanie and Cy with DRAS. So they have to provide the training back to them with 80% accuracy. And then they must attend at least one session provided by Melanie and Say to the general public, so they know how they conduct the training. Once approved, the trainers are added to a roster that's going to be maintained by the ARC of Arizona. And then annually, they would be required to submit proof of conducting at least 4 classes to maintain their approved training status. So 40 trainers conduct 4 trainings every year in order to keep in a good status level with the ARC in order to meet that requirement. And then if not, they will have to go back through the process again. There's no information about what happens if a person just decides not to meet at the 4 requirements. How many chances do they give them? Do they just drop off? So there's still some outlying questions that I have, but the bulk of this renewal application is going to be centered around the train-the-trainer model to have this support decision-making, what they've done to date, become a little bit more self-sustained. I questioned whether 40 is a realistic number to achieve. They seem to, they will have no concerns on having that number, but which is why we asked for benchmarks to see if they're able to achieve 15 new trainers by April, which is obviously going to come in all these numbers will come in the last quarter of this 3rd-year period. So it'll be in the 4th quarter when we start seeing benchmark numbers. But they would be reporting quarterly to let us know how this is proceeding, whether they're going to be on target. I don't have any else to say about this program as far as the 3rd year. Questions, or if John wants to add anything?
Yeah, the only thing I would add is that, as everyone knows, supported decision-making has been an effort underwritten by the council for a number of years. It is an alternative to guardianship that we strongly support and promote. And I think generally we feel very good about the work that's been done by the ARC of Arizona and by Disability Rights Arizona over the last couple of years to raise awareness and promote adoption of supported decision-making. One of the things that I would like to see from this project, if at all possible, is some tracking on the number of supported decision-making agreements put into place by those who participate in some of these outreach efforts. And I don't know if we can, because it doesn't require any kind of legal filings or anything like that, I don't know exactly how we would go about it, but I think that's a point of discussion for the ARC of Arizona and for DRAZ as we move ahead and see if there's some way, if they're going to be training trainers, can those trainers then be doing a little bit of tracking, or can the ARC itself be doing some tracking? But that's a discussion we can have and see if it can be built into their proposal.
Good. I would encourage that. We often do so much work on training on something, but we don't always know the outcome of how effective it is. So if there's any way that they can work that out with the trainers going forward, but John will be interested to hear how that discussion goes. Yes, Kathy.
So based on past experience of having trained the trainers, if this train the trainer if there's a certification that can be given to them, something that's important, sometimes that motivates trainers to do the work. I wonder how you will get 40 trainers that will just want to go out and train and not be compensated, but just feel good about training. Do you know what I mean? There's my past experience is that people do things more if they're going to be compensated. And so I'm afraid keeping 40 train the trainers, how are we going to motivate them to continue training if they're not being compensated? What is it that motivates them to do this? But I'm not trying to be negative. I just know that past experience, it seemed like either there's a great certification that really, you benefit from, or you're paid for training. So
well, you nailed it, Kathy. For me, is that I've seen a number of trainer models start and they end very quickly because there's a lack of follow through, or people just can't complete the requirements because of other their day jobs and family lives and other things kind of come in. 4 trainings doesn't sound a lot, but it is a lot because they're going to be required to, my understanding, I guess, is, or maybe it's not really clear here and can be asked further, is they're going to have to identify those groups to meet and conduct a training. And what does that look like? Is it just a handful of folks in the classroom? Or is it, are they required to make sure they have a certain number of participants, to keep that certification? Is it something, if the certification part of it is necessary, I understand, whether they get some sort of document from the ARC or something that looks, official. But they're not going to be paid. I think that was a question that had to be clarified in their budget, was the cost of this. And it's kind of rolled into more of the administrative side of it to oversee it. So there's not going to be some sort of monetary way to, to pass on to these 40 trainers. I just For me, I have just still a lot of questions about it. I don't know whether, we can ask these additional questions of them and have them prepare, a clarification for the full council meeting, certainly, and then see how this looks overall.
Or the other thing is, do we as a council look down the road to see how we could make this more important for people? I'm not sure. We'd have to hash it out, but maybe we start here and then down the road we do some other things to try to make it more important that people value this certification. But.
Yeah, well, definitely we want to make sure that if we are asking them to change anything, add anything, enhance anything, and definitely the tracking number of agreements is really important to do. And making sure they are able to request that from the trainers, from the individual trainers, as well as from Melanie and Cy, who are still doing these trainings around the state. And they have the training curriculum varies depending on who the group is. We've asked them to do a lot of outreach to the health community and mental health community, behavioral health. And so they kind of modify their training curriculum to make sure it fits for the audience that they're doing. So that's really important that they continue to maintain that and conduct the trainings and to do the evaluation of the participants on their level of knowledge, their level of skills. And one of the things that Melanie did clarify in the clarification was how families or professionals are using this. She said that on the page, I think it's page 4. She stated families have stated that they are more prepared to implement support decision agreement I'm reading this verbatim, during our training sessions. Families have expressed optimism for there being an alternative to guardianship. She goes on to say that some families have expressed that they still believe that due to their child's high level of needs and inability to communicate, that guardianship is still needed. So we reiterate the capacity should always be fully explored for alternative means of communication. Regarding professionals that have attended the sessions, she stated more specifically, case managers for health plans, support coordinators for DDD, APS investigators, and educators have stated they will be including support decision-making into their resources to provide to families they support. So she is getting some feedback on how it's being used. It still needs to be collected so that we see what the feedback is from folks. And I think there is going to be a percentage of families that have concerns about whether this is the right method for them to use. But it'd be good to capture that information. It's good to know that.
Right. Yeah. And maybe at some point, some of the agencies, if they could be given, I don't know, like a Better Business Bureau kind of emblem or something that says, hey, we support decision making or something like that. I don't know. But anyway, I'm taking up too much time, but those are my thoughts on that.
Okay. No, thank you for that. I appreciate it. I jotted them down.
That's okay. Jana, do you want to expand on your comment?
Yeah, I was just thinking about what Kathy was saying about, how do we, thinking about that same line of thought about how do we keep that torch lit, so to speak, and if it's just individuals, that might be tricky, Marcy, to your point, people have lives and they, kind of lose motivation. So perhaps giving them some ideas about reaching out to community-based organizations, like Encircle Families and others that already have the infrastructure to maintain the training. So if we could be identified as some of those groups maybe it's more of a group, an organization, less focus on individuals that are doing the training. And then you have a bigger footprint and a little more infrastructure to maintain it over the long haul. Because I know we could definitely do that. I mean, we would carry that lampstand forever, so I could easily say that. So I was just thinking out loud about that.
Okay. No, thank you for that. That'd be another point that we could raise with them.
Yeah, that's a really good point. Thank you to both of you for your comments on that. And thank you, Marcy, for the information. Are there any other comments or questions? Okay, and for staff, based on what we're hearing, I'm comfortable supporting year 3. Does staff recommend year 3?
Yes, I do. I would do it with the caveat of asking additional questions from Melanie to clarify from the
Okay.
discussion today. And there might be additional ones at the full, at the full council meeting that we could get. So I think it's just more of making sure that they can, consider some of these recommendations, some of these points made.
Okay. Do you think that you'll be able to get any of that information before our full council?
I will certainly try and have
Okay.
that included.
If you can.
Yep.
Oh, okay. I understand. It's not always possible, but that would be great. Okay. Well, if there is no further discussion, I'm going to call for a motion to approve year 3 for Arizona supported decision-making training with the ARC of the U.S. to the ARC of Arizona and the amount of $70,000. Do I have a motion?
This is Bijet's.
Okay. I heard Monica, and do I have a second?
I'll second that. This is Bijet.
Thank you, Vijette. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. Is anyone abstaining? Okay, thank you. Motion carries, it passes and moves on to full council. Okay, so number 3, Arizona Self-Advocacy Coalition.
Yes,
All
I
righty.
know, and I'm running out of time, so I apologize. So I will try to cover
It's all right.
quickly. We got some other items on the agenda. Okay, well, again, the ARC of the U.S. and the ARC of Arizona graciously submitted in their renewal for self-advocacy, which is Arizona Achieve. Basically, it's the self-sustaining self-advocacy group called Arizona Achieve that the ARC of Tempe with Ryan Berry has really shifted this whole process into a different light. And we really appreciate all the work he's going because he's leaving for law school at the end of this month. So we did have a number of clarifications. I did actually talk to Ryan last week when he was in the office. He introduced me to the new person that's going to be replacing him, which is Becky Hill. And she is a wonderful mom of a child that was nonverbal, but is now using assistive technology, and the world has opened up for both of them. So it was a great conversation and nice meeting Becky, who is going through a lot of training with Ryan. What Arizona Achieve is 3 primary key areas. It is the coalition of self-advocates that meet monthly, and they have developed a leadership training curriculum that they are now turning into videos and translated into Spanish, and ensuring that there's different components that self-advocates can participate in of their choice. So developed by them. And so it's really good to see that this is moving forward and is a priority. They meet monthly online. So Ryan's been like crazy meeting them online. They talk about various issues that are important to them. They talk about legislative issues. They talk about transportation issues. They talk about healthcare issues. So the meetings are really all around what's going on in Arizona and how it impacts their lives, which has been really good. They have also identified policy issues that some self-advocates want to go down to the legislature and participate in hearings or learn how to communicate with your legislator and your own representative. So it's really important they do that. They have a number of self-advocates that are on different boards and commissions, which is another requirement of the federal act. So they are maintaining that. And then the third component is the peer mentoring. They did have the peer mentoring as part of last year's program. The staff person there left halfway through, I think they were able to complete 6 total matches. This year they're gonna just downsize it a little bit for Becky because she's gonna have her plate full with doing a lot of other things. But they do plan on having a cohort begin month 4 and then another cohort beginning later on in the year. I believe it's month 10 that will be cohort 5 for peer mentoring. So it's adults matched with self-advocates to identify those areas that they want strengthened for them, that the adult mentor can help, help that self-advocate achieve. So that would be the additional component they're going to keep in. The other thing that I know with Becky is that she's going to keep up on all of these. She was part of this renewal application to oversee some of the tasks that are going to be carried on. They're going to continue with the retreat. They just had their retreat this past Monday, or either last week Sarah was at. Sarah attended. I could not attend. And so they are going to continue much of what has been done in place by Ryan, but Becky will have to pick up, the majority of the workload, and I think she's going to be just fine. So what we asked them, the clarification is just to pinpoint specifically a little bit more clarity on their timeline. Like, when do you plan on having certain things completed so that it's not vague? When do you plan on instituting some of these things so that we're a bit more clear? Their reports are very detailed. They do a lot more than what I'm saying here. They have a very active website, a very active social media. They let us know of all their ongoing activities so that we can help promote it and enhance it. I know Jason and John attend sometimes their monthly meetings. I'll pop in on the monthly meetings to listen in as well. And they also, those self-advocates are very, they also participated in the ops training with NAU. So Ryan was able to hook them up with John and one of their training activities, and they participated and provided really good feedback. So I don't have, with Ryan leaving, wish him all the best in law school. He's going to Yale, I believe. It's going to be nice to work with Becky, and excited to support her in this, in our self-determination goal.
Okay. It sounds like this is much more robust than what we've had from self-advocate projects in the past.
Yes. Yes.
Okay.
And it really is by Ryan. And I have to say the partnership, with Sarah and Jason working on the communication to enhance and help support. But Ryan really knew a lot of that. There's something about being in your 20s and 30s that you're just a little bit more in tune with that than someone like my age that could care less about social media presence. But yes, and I think, it's going to be great to just have someone else look at things from fresh eyes, present new things, coordinate new things. So he left a lot of things in good hands, in a good place for Becky to pick up.
Okay. Okay. So based on that, staff is comfortable moving forward?
Yes.
Okay. Okay. Are there any questions or comments before we take a vote? Okay. Hearing none, I'm going to call for a motion to approve year 3 funding for Arizona Self-Advocacy Coalition with the ARC, the ARC of the US and the ARC of Arizona in the amount of $60,000. Do I have a motion?
Move.
I can motion to approve.
Okay.
Somebody though.
Kelly, that's okay. Kelly, I heard you. Do I have a second?
I second.
Thank you,
Kathy.
Thank you, Kathy. All those in favor of approval, please say aye.
Aye.
Aye. Aye.
All those opposed, please say nay. Is anyone abstaining? Okay, thank you. Motion passes and it moves to full council. All right, agenda item F, our full council agenda. Let's see, for 2 weeks from today. Okay, it looks very similar to today. So if you move down to the bottom, other than our committee work group report outs, we're basically going to do a repeat of today, except for our report outs. Okay. Any comments, concerns? Okay, and no guest speakers, so no, good, we're good that day. All right, agenda item G. Does anybody have any announcements that they need to make? Okay, the answer is a no. I will move to agenda item H, call to the public, and I do not note any members of the public on here. Nobody snuck in? Okay. All righty. Agenda item I, we're going to adjourn. Everybody have a wonderful weekend. Stay in the
Hopefully I
pool or
see you all at our
inside.
conference on Monday or Tuesday.
I know our staff is going to be there and they can tell you, I'm unable to attend. I've been out of town so long, so I'm going to miss it this year. I've making up for a lot of appointments, but who on our staff is going to that one? We got a few.
I'll be there. Me.
This is Mike. I'll be there.
We've got 3. And
It'll
I
be
bought
the second day. And if anybody can come out to our surprise focus group on Tuesday evening, I would highly encourage it. It's great to have staff members there. Vijette was a great co-facilitator, really, in Havasu. And we'll be at the Surprise Senior Center from starting at 6 p.m. out in the city of Surprise on Tuesday night. So please come out if you can.
Thank you, Sarah, and thank you to staff for doing that. I know you guys have kind of been all over the state, and thank you, Vijette. I heard that was a very robust conversation, so thank you so much for stepping up and doing that. Okay.
And I want to share that there's been a lot of just social media posts on how amazing the forum was and how happy people were that this was held here in Havasu, and it wasn't just in Maricopa. So super excited about that.
That's
Send
awesome.
some my way. I want to see those. That's
Yes, me too.
Yeah, I will send those.
Me too, please.
Yep.
Thank you.
That's amazing. So thank you so much. You know what? Council member involvement is so important. It matters so much. So thank you for taking time. I know you have a very busy life, so thank you for doing that. You obviously are a great leader in that end of the state. So thank you a million. All right, everybody. I hope you all have a good weekend. And yeah, I'm either going to be in the water, probably in the air conditioning. So
Take care.
all right,
Thank you.
guys. Bye.
Bye.
Bye. Bye.
Bye.